Kia ora koutou, ngā mihi nui, kia koutou. I just called Jan Logie MP. I'm a Green Party Member of Parliament and have been in Parliament since 2011. And one of my big areas of passion and focus has been around our work to end domestic and sexual violence. So it's a real pleasure for me to host these amazing people who I will introduce you to in a minute for a conversation about domestic and sexual violence during the COVID-19 response. And just to acknowledge that this can be a really tough conversation, but it is a really important one, especially in times of crisis. And on that note, I will just acknowledge that for some people of you listening, that this may, at times the conversation may be triggering or uncomfortable. So please do look after yourself. And hopefully on the screen right now, you will see phone numbers for helplines, and do make sure that you reach out to those if you are feeling uncomfortable, and take a break from the conversation as well. You can always follow up with a direct email because we're happy to talk at any time, and share your insights in the chat. And I know that the people who are part of this conversation want you to be well and feel nurtured or empowered by the discussion tonight. So that is what I hope for all of you listening. So now that we're all on the same page, hopefully, and know what we're talking about tonight, we'll open the event with a karakia. So kia tau te rangamare e, o te rangi e tū nei, o papa tuanuku e takoto nei, o te taiao e a whenei, ki runga i a tātou, tihei mauri ora. Which translates to as, may the peace of the sky above and the earth below and the world all around us rest upon us. And now I get to introduce briefly, before you hear from them, our wonderful panelists who are mostly, who I've known actually all of them for quite a few years now, which has been my great privilege, and people who I'm really inspired by, many of whom work in my own rohe around the Wellington region, Porirua, but not all. We have people from much further afield tonight as well. So we have Kyla Rayner from Wellington RapeCrisis. See her waving, and Russell Smith and Joy Wiata from Korowai Tumanako. Excellent. And Conor Twyford from Wellington Sexual Abuse Help Foundation, and Caroline Herewini from Tiaki, Wāhine Refuge, Porirua. And so tonight we're hoping, in the short time that we've got, that we're going to cover a few questions. So the first thing is, what's happened in the last 5 weeks? What services are available, and are there likely to be changes as we move into level 3? And to hear from them about any advice on how we might get involved in preventing people from causing harm, or supporting those who may have experienced or be experiencing harm. And I'm also keen to know any lessons that they may have learnt over this time, and what they want to see in the future. And there'll be an option, hopefully, if we can get to it, to have some questions at the end. And I need to say that this is a conversation that I'm facilitating as a Green MP for the Green Party. And because as part of our kaupapa, we're always looking for ways to engage and listen to the knowledge and experience of the experts in our communities, which I think is where the real knowledge lives. I will talk super briefly, already I'm sick of my own voice, but I will talk super briefly about what government has been doing. And if you've got any questions about that are related to government or specific departments, I've got a team on board tonight who are taking note and will feed back those questions through the appropriate channels. But I'm not in an official government role tonight, so I won't be answering them tonight. Okay, so want to start by letting everyone know that services are still available for people who need them. Even though we're all at home, this should not stop you from reaching out for help if you need it. And that's been one of the key messages that we've been trying to keep emphasising over the last 5 weeks, because overseas evidence of, and even after Christchurch, we realised that was one of the key problems, was that people were unsure whether the help would be there in that situation. And we've focused on trying to make sure that our frontline services, including the police, know that this isn't an exceptional situation, that actually we expect everyone to take the action as they can to keep people safe, and that the use of violence is not normally acceptable, and it's not acceptable now either, even though these are difficult and stressful times. And so part of, we're hearing from our community organisations tonight, and part of what government has had to do is get some more resource to our frontline services, because the reality is that their baseline funding wasn't enough to be able to ensure that they were able to respond to the needs of their communities appropriately in this time. So government put $27 million, with 12 million of that focused specifically around family and sexual violence response. And we may hear about how that's been flowing through to the community tonight or not. And we've been focused on trying to link our specialist services with some of the essential services like supermarkets or pharmacies, and looking at ways where we might be able to make it easier for people to reach out for help. So that are just the kind of the introduction about what government's been doing. But as always, the real points of change and hope and safety are in the relationships in our communities. And the people who know that best are the people we have here tonight to talk to you, to share their experiences. So I'm very stoked. And I want to acknowledge too the people who may be joining this call who also work in any number of these agencies right across the Motu. And I know how long people have been working in this area in a way where they've been really under-resourced for the work that they do, and how hard that has been, but people's absolute commitment to hanging in there because they know that the lives and the dignity of the people that they support requires them to do that. And I just have so much love and respect for all of your work, and just want to start by thanking you for that. So on that note, I'm going to now hand over to and get a drink of water, but I'll hand over to the wonderful Caroline Herewini for you to tell us a bit about how you and Whare Tiaki have dealt with the lockdown.
Kia ora te. A koe o ngā mano, a matu tamaware o tapu me ngā anehera pono me te māngai. O mai peki te ora, peki te kaha, peki te māramatangi ngā wākato, ko te māngai hei tātuku mai aine atini ai. Kia ora whānau, ngā mihi mahana kia koutou. Ko kararai no Herewini taku ingoa, ko kai whakahaere o te whare Tiaki, Wāhine, Refuge and Porirua. Oh, kia ora everyone. I think what's important in this space is that for whare Tiaki is to maintain that we are kaupapa Māori service and we're here to protect the whakapapa of our whānau and our kaitia, and that is reflected in our kaitiaki obligations and responsibility. And what is paramount is around protection, participation, and partnership. I think what we've observed is one of the huge learnings that we've got out of this is whānau resilience, and whānau kotahi is what we've seen throughout this 5-week pandemic. So maintaining our protection around whakapapa is what has been key to our rituals of engagement through the entire process, and engaging, meeting with not only the EOC civil defence response, ensuring that whatever had come through the multiple ways that we can be contacted is ensuring that those protection those protection systems, protective systems are in place, and that the rights of our wahine tamariki and their whānau, including their partners, are intact. What has been important is that it's been business as usual for us, and that our public and our community, our whānau, knew how to get hold of us through many systems, including, our 0800 crisis line, through safe sites, through the police 105, through the community response team, so that it was business as normal for us. And even though the main office might have been closed, that all our services, I think the main important one is that you could call for help, you could call for support, no matter what time of the day, no matter where you were at, that you could get help and support for you and your whānau. I think it was also really important that whānau also realise that, in your bubble, there was also as part of your family, there was also your animals, and that they could be taken care of as well. I mean, huge indicators, there are multiple indicators around flags. And it was really important that in the bubble, as though there were already restrictions, and that at any time, if it looked like your bubble was going to burst, that your whole family had access to getting support. Protecting whakapapa is what we do, and in multiple ways, whether that have been in your home, in our home, in our whare, or in a motel, any place that we needed to get you out, get to you, there was a process in place. I think that was important to know.
Kia ora. Thanks, Caroline.
Welcome.
So I'll pass now to Conor and Kyla, and interested to hear how it's been in terms of the work you're doing around responding to sexual violence. Can you tell us how you've been dealing with the lockdown and what's happening out there and what you've learnt? We'll start maybe with Conor.
Kia ora koutou. Thanks so much, Jan, organising this. We were talking about when we were getting ready for this panel, how great an opportunity it is for people who might not normally be able to come to meetings to talk about this issue to actually be able to do this. So, you know, technology keeps being a new way to connect with people, and I think that's one of the positive consequences. So welcome to the people out there. Kia ora koutou. I'm Conor Twyford. I'm the Chief Executive of Wellington Sexual Abuse Help. Help has been around since 1985, and our vision is to end sexual violence in Aotearoa along with our sister agencies. We support survivors of sexual abuse, their families and whānau across the Greater Wellington region. That's anybody of any age, gender or ethnicity. We have a crisis line that runs 24/7. We have a small team of social workers and a team of counsellors who are there to help people. And like Carolyn, we moved pretty fast. We got into business as usual quite quickly. And we had to, like a lot of people, that meant at level 2, we all moved to work from home. And but we adapted very quickly, and we're still here for the people who need us. And it is, I think, as you said, Jan, unfortunately, sexual and domestic violence doesn't stop because of a pandemic. And if anything, we expect a lot of people are having a very difficult time. So what that looks like at Help is that our crisis line is still going, and our social work team and our counsellors are still going. And you know, we're pretty innovative in the not-for-profit sector. So we've learned how to use Zoom pretty fast, and so have our clients. And you know, and for some people that's difficult. They may not have the resources for that. And for other people, they've adjusted really quickly. What have we learned? And I'll hand over to Kyla very shortly. We got some feedback quite early on that some people thought we were too busy to take a call, but actually that's what we're there for. And we really want to encourage people to come forward. It was great that the government classed us as an essential service. I think it recognises how serious the problem is. And we're used to thinking around corners in the not-for-profit sector. So we got moving really fast. I think the government's response to the COVID has been very clear, and that's enabled our agencies to be very clear and quick as well. And I guess just to wrap up before I hand over to Kyla, one of the things we've learned is that for some people in lockdown, they've been dealing with anxiety and PTSD and depression for a long time now, and they've developed some pretty good tools and techniques. And for some of those people, those tools and techniques are coming in very handy now. For other people, it's not so great. Like every household, every person's experience of sexual and domestic violence is different. But the important thing is that people seek out our help, all of our agencies' help, when they need it, because that's what we're here for. Kia ora.
Talofa lava everyone, I'm Kyla Rayner, the General Manager here at Wellington RapeCrisis. Thank you so much for this opportunity, and it's a real privilege to sit alongside these other people that are doing this incredibly important work. So we also moved quite quickly. We were very fortunate to have our services manager, Sandra Fuller, become quite interested in this global pandemic at the end of January, and we saw it as a really good opportunity to look at our business continuity plan, which I'm incredibly grateful for, because it meant, much like everyone here, we were ready to respond immediately and move to remote ways of working and think about how do we continue to engage with our current clients and let them know that there are these other ways that we're able to deliver services. So we're very much open. We're still doing counselling and social work. We are absolutely taking new clients. We are absolutely here to talk to family and friends of survivors around some of their concerns and how they might intervene. And while that doesn't look like the face-to-face work that we treasure in this space, being able to be with someone in their physical presence, that's been really difficult for some of our staff to come to terms with and find new ways to work around. But like Caroline was saying earlier, technology has enabled us to have these other ways of working with people. So we're doing Zoom sessions, we're calling people on the telephone because they don't like Zoom, we're texting people, we're doing email support, and we have been able to maintain our engagement with all of our current clients, which I think shows the value of having this support in people's lives, and the fact that we work with people holistically. So we're interested in the ways that COVID-19 have exacerbated or made more complex some of the problems that people were experiencing in their lives. So it's been a real change. We've got a really strong and beautiful culture at our workplace, and not being able to be with each other, to hold each other through this work has been something that we are thinking about all the time, and thinking about new ways to be there for our clients, but also to be there for each other and our staff. One of the immediate learnings is for us, absolutely, the value of our national networks. So a massive shout out to Tornest and all of the incredible work that people across our sector are doing, and the people in that national office to provide us with the right guidelines, to create a space for us to share knowledge, has been incredibly critical to having a really evolving and innovative response to all of the different challenges that we're facing. It also shows us the inequities across our country. So I always recognise the privilege of operating the service in Wellington, and I know that that's not the case for some of our other communities where they're looking at really low staff capacity and concerned about how they can continue to deliver service. So a big shout out to all of those people operating within those kind of parameters as well. Completely support what Conor said about the government response. It's been really good to work alongside the really clear levels, and we've seen, you know, some funding come along to help us operate in this new way, and also provide our clients with better wraparound support to address some of those wider social needs as well. So really felt that sense of urgency to get stuff up and running, and I think one thing that's made us think is we'd love that sense of energy and urgency all the time, because this has been a crisis for New Zealand all of the time. And so to see that release of funding, to see our ability to work with whole families and address their social needs, their impact on the other ways that they're working through their trauma, has been fantastic. And I'd love for that to continue, and for us to all sense that there is an urgency, and there's also stuff that we can do to respond to that when we're well resourced.
Malo. Kyla, that's really nice, and linking in terms of the difference experience from Wellington to other places around the Moto is a perfect segue for me to hand over now to Russell and Joy from the far north around your experiences of working there, and what you know also about what else is happening around the Moto for kaupapa Māori services.
Tēnā koe Jan, tēnā koutou katoa. Ko tainui te waka tararua te maunga o Takita Awa Ngāti Raukawa te iwi, nai te horu rawa ko Ngāti Kuriki ngā hapu, ko Raukawa te marae, ko Joy te Wiata, tuku ingoa. I'm a co-director of Korowai Tumanako with Russell, and he'll take the other part of the conversation shortly. We are a kaupapa Māori sexual violence service, specialist service, and we do offer a range of prevention services, as well as, in particular, we work with people who have had or are participating still in harmful sexual behaviour or are thinking about it. So, yeah, so along with crisis support work and various other things that are a range of sexual violence services. So in terms of what's happened since lockdown, and I think Kyla's quite right, because we're all involved in crisis support, responding to crises, it's been a reasonably seamless transition to this period of time and doing our mahi. Of course, we've had to learn about Zoom and other technology, as we discovered earlier this afternoon. One thing that I've learned in particular is that eyes start glazing over. You know, you've spoken for a bit too long. But, you know, we've still managed to stay in touch with clients, some who shouldn't have access to the internet, we're making phone calls with. we found in particular that we have been able to build even closer relationships with other services. We've been meeting with them regularly on Zoom, and that's been wonderful because as well as whakawhanaungatanga, we've also been able to share the ideas, you know, the innovations that have been happening around the country amongst kaupapa Māori services. We just think our people are absolutely awesome. Our whānau are giving awesome feedback, and we are able to you know, rearrange our practice or learn from their feedback as well as from each other. We've been staying in touch with the other services in Te Tai Tōkaro that we have a close relationship with, and as well as, for example, we work with the schools. So we've been staying in touch with schools, organising projects for when the restrictions ease up a little. So basically, we're doing pretty much the same. We're running a group with our tāne by Zoom, which is interesting. But, you know, we do things a bit differently. Shorter sessions and more frequently is probably what we're doing. One of the things we've found is with some rangatahi are feeding back that they prefer to meet via Zoom. So that was a really interesting finding that may well inform our work as we go on. Even when restrictions are lifted. But anyway, I'll hand over to Russell. He's got more to speak about things we've learned.
Kia ora koutou, ko ime me te maunga, ko awaro te awa, ko whangaro te moana. Noki Aldrich, me Dorian Renata, o ku mātua tūpuna. Tahua i Ngāti Pākehā, Ngāti Ringai, Tāwaki, o ku hapu. Ngāpuhi Ngāti Kahu, ki whangaro tōku iwi. Kia ora whānau, Russell Smith ahau. Look, what we've seen is really effective and enhanced responses by a number of kaupapa Māori services around our motu. They're moving quite quickly by anticipating the distress coming from the COVID-19 pandemic, followed by the level 4 lockdown. Simply put, kaupapa Māori services expected COVID-19 to add another level of trauma and difficulty to an already traumatised and troubled community. So that's what we've seen. What we've learned is that what we anticipated and planned for actually worked. So in simple terms, we made contact with all the whānau and communities in our motu prior to lockdown, normalising what to expect, what they could do, and how together we can get through this together. It worked because kaupapa Māori prioritised whanaungatanga in connection with whānau and services for many years prior to the pandemic. And when we look to the whakapapa of other damaging national and international events, it was the whanaungatanga that held our whānau together over those very difficult times. And we are the mokopuna of those events. So that tuku iho, the mātauranga, is passed down to us. So we're used to pandemics. As others, the trauma is very evident in life, and so are the people that we work with. But we preempted what layer the pandemic would bring to them. So kia ora.
Can I just add just one last bit to that, because I just want to kind of shout out to the Māori Wardens and Māori Women's Welfare League groups around the motu, because they've mobilised incredibly well across this time, particularly in remote areas, but here on in Te Atatu in particular, our group here has really responded to whānau that are, you know, at this particular time, whānau that need help in this lockdown period. So, yeah, that's not just services that have responded well here, but the community groups in general.
Ka pai. Thanks for that. And I see some questions are coming through in the chat that we'll get to later. For people who have just joined in after we started, we've just been hearing from some of our incredible frontline organisations about how things have been for them and the people that they're supporting over the last 5 weeks. And we're going to be talking about what might change in level 3 and what actions individuals might be able to take or to support people they know. But I also just want to flag out that I did see come up in the chat an acknowledgement from at least one of the people watching for all of the work that you do. And I want to add my acknowledgement to that again after hearing about the amazing adaptability and that commitment to support our communities, whānau, and individuals. So I guess that next question, which I'll just kind of leave as an open for anyone to jump in on, is for your agencies and the people that you're supporting, will anything change as of midnight tonight when we move to level 3 beyond, if they're lucky enough to have the money, being able to buy takeaways? So feel free just to unmute yourself and jump in for this.
We certainly don't expect much of a change apart from the isolation with the issues that we're experiencing in the places like the Hokianga, East and West Hokianga and those areas. We do have concerns, and that, you know, we would have hoped that telecommunications, they would have got up there and put up some extra sites and all that so that we can get into those spaces, and unfortunately they haven't done that. But apart from what we're doing now, we just, for us, will be more the same until at least we get down to level 2.
We don't expect to change what we're doing in particular, but we do think that perhaps there might be an upswing in reports now that once the lockdown lifts. Our crisis line went a bit quiet at the start, and that was really concerning for us. Social work and counselling has been pretty constant, but yes, we because there's sometimes a delay for people in reporting sexual violence, we're wondering if we're going to get a bit of a flood of calls once the lockdown lifts. So we've been gearing up for that and talking about that a lot.
Yeah, we're very much the same as Wellington Help and what Conor's saying. So our service delivery will look very much like it looks currently. And while we've been able to remain engaged with all of the people that we're working with, we had seen quite a dramatic decrease in our new intakes. And for people who, we work with a lot of people who access us for historic sexual abuse. And so a lot of those people may feel like they want to wait and see what happens post level 4 in terms of contacting us. And with people currently living with that harm in their home, I imagine they are considering and using those strategies and trying to amplify those protective factors currently while we're in these restricted and quite uncertain times. And we anticipate that we will see an increase in new clients as those levels start to come down as well.
Kia ora, yeah. So what we've seen, well, one of our concerns is although Refuge and we've had Zoom meetings around as a movement and as Whare Māori, and we've seen an increase in demand in the city areas, and I believe that's because of access to service. That I mean, I've got calls from Pahawera who has limited access, and asking for some ideas and tools around engagement, and so you can see the different levels of participation from our whānau in rural and city areas. I've seen the uptake in that, but one of the concerns that we've had in Porirua or in Lower North is the clustering of whānau now, that normally out of COVID-19, the clustering of wahine now coming out and seeking help. My concern is that we have Porirua is small, Porirua are small, and appropriate residential care needs to be sought, and all the safety factors that need to go alongside that. And even though it may be a short time in, it needs to be an appropriate facility. And so my concern is that in level 3 is access to those appropriate facilities. What's also come out in level 4 to 3 on the ground is the amount of the level of institutional power and control over Māori women, with the threat of losing their children has been apparent, with a time frame as an excuse to move plans through. So when we're talking about protecting whakapapa, we're also talking about our kaitiaki obligations to keep whānau together, and time frames used as an excuse to miss, a process out. And so it takes me back to Poal Te Atatū. It takes me back to, whānau agreements, and following through that process. So, yeah, going from 4 to 3, business as usual, but with these constraints in place, as well as the virus.
Kia ora, Caroline. I saw that we'll have substantive questions at the end if we get time, but I did see flash up in the chat a question, somebody wanting to clarify what you're meaning about clustering. And if you can just talk a little bit more. So groups of
Wāhine, like groups that you normally wouldn't see coming all at once, but from one group of Wāhine. And Porirua is small, so I don't want to go into the naming, blaming, shaming things, because it takes courage and bravery to step out of a space. Yeah. It takes a whole, amount of courage. And so what we're seeing is another layer within the bubble once it's burst. And so once one comes out, 1, 2, 3, 4 come out. Right. And so, we're very grateful for the putia that MSD gave us, but I can guarantee you that should this continue, that's going to go nowhere. And we're back to frontline services being under pressure again, and back to frontline services like Refuge, who do 24/7, who are there to pick up that phone when everyone else is having a sleep and to respond. We have to put them somewhere that's safe and responsive. If we want to be solution focused with these outcomes around COVID post, then we need to be serious about what the solution is and have the appropriate resource to follow through. Otherwise, you're setting us up, you're setting our whānau up to fail again, and we forever, ever, ever are asking for permission. Can we please have this? Can we please need this? We need this to do that,
Yeah, thank you. And, that it's one of those points that I think we've been hearing from people who have experienced violence or have used violence even, but are wanting help, as well as all the advocacy organizations for a long time, is that help is a whole lot of things. sometimes it's a roof over your head, sometimes it's the support person, sometimes it's a specific kind of counselling, sometimes it's food. And I think you've all spoken to that in different ways really clearly. Just wanting to bridge now a little bit around, so we've had a bit of a discussion around the amazing work that you're all doing around providing that crisis response. But I'm always keen for us to also hold the conversation about prevention. And of course, crisis, particularly through this time, has to be front and centre. But I think if we lose sight of the need for and action to prevent violence, then, you know, we're condemning ourselves for it to keep repeating. So I'm really, and I know everyone in this conversation was always holding that view of the individual and the whānau and the community and the layer of government and the intergenerational perspective, all of which impact on individuals and whānau. So I'm on that kind of lead-in, hand over to Joy and Russell, because I know that you do quite a lot of work around prevention, and then others can come in if you want, because I know you've got lots to say on this too. Just about, I guess, what you think we need to do to bolster our prevention and support of the crisis response and early intervention when working with people who are have used violence or are on that pathway to using violence to hurt someone.
Yeah, thanks, Jen. One of the principles of effectively utilising prevention and developing prevention models is understanding the pretext and the post-effects of violence. Victims and survivors, they're experts of their lived experience of the abuse that they've had to endure. And similarly, people who practice abuse and harmful sexual behaviour are experts of their violent behaviour. However, like many, they need support to prevent any further harm. We utilise this information combined with the therapeutic and clinical mātauranga, Māori knowledge, to support those who practice violence and harmful sexual behaviour. So in the prevention space, we employ this information and intelligence, or lack of, from experts who practice violence and harmful sexual behaviour. We combine both victim survivor and perpetrators and violent harmful information to produce messages and education for whānau that they can easily apply in their own environments. You can't identify an offender or person who does harm by how they look. You can only identify it by behaviours, and particular behaviours if you can identify them really quickly. On another level, we utilise what we know about prevention to support and enhance whānau, community services such as kaupapa Māori services and tauiwi services. One of the statutory spaces we work in is in a post-vention primary prevention is with the New Zealand Police, the frontline adult and child sexual assault teams across the motu, triaging and supporting police on managing active sexual violence cases, etc. So to preempt some of that stuff. I'll hand it on to pass on to Joy now, just to how people can be supported if they use violence or are thinking about using violence.
Okay, so just a couple of really clear messages to begin with. If you are using violence, stop it. It's the first prevention message. Just stop it, and stop it now. If you're thinking about harming, don't. It's that simple to begin with. And what we would really encourage people to do in terms of ensuring that harm doesn't occur or no more harm occurs is to talk to somebody. We know it's a really difficult conversation to have, and there's a lot of fears around that. But there are services such as ours that you can call. There are other help services. if you've got someone you can speak to, you see most people will speak to their friends if they've been harmed, you know, or their family perhaps if they've been harmed. But when you've been doing the harming, the number of people you feel you can speak to is very tiny, it's diminished, because it's not something you want people to know about. So if you're ready to get help, and we hope that anybody that is listening tonight might want to get help, will want to get help, then we'd really encourage them to take good use of some of those helplines that are available. Call us now. We also, along those lines, you know, even within the lockdown, the different restrictions, if you've been doing harm, or you think you've been, that you might do harm, then you need to get out of your bubble. And there are services like ours that will support you to remove yourself from your bubble safely, because the people within your bubble need to be safe. Children can't remove from a bubble, but you can as an adult or someone who's been harming. And we want to reassure whānau too that it's, you know, we realise it's really confusing, and there's a lot of fear around how people may be treated in the system. That there are services such as ours and the others that are represented here that will walk you through the system, that will ensure that you get on the track to being safe again in your community and in your whānau. So in terms of what, you know, so does this sound like therapy or major intervention? All of this is prevention efforts when we are going, you know, of course, the ultimate prevention is before anything happens. But once something has happened or is likely to happen, well, then these are the kind of things that need to occur in order to stop things from going any further. So, Russell.
And if I can add, the messages put out in the community, we've got to try and change the messages so that people that are doing harm will seek help. If we continue to say, put out messages like burn them all and put them on a heap on an island somewhere, that doesn't help the 9-year-old young person that we're working with who has concerning sexual ideation. Those sort of messages, what they do is they push the behaviour underground. What we want is we want the behaviour to come forward and come out, and we want people who are perpetrating harm to get help so that they don't create more victims. So that's part of the prevention work.
Kia ora. So just conscious that we don't have that much time left, and I know that linked to that, about that message about people reaching out for help, is that there's probably people watching this who might be worried about friends, family, neighbours, a workmate, either that they might be hurting somebody in their whānau or the place where they live, or that they might be experiencing harm. So I'd love it if you could share some of your wisdom with us about what people can do from their homes or in their workplaces if they have either of those worries or concerns. And I'll do the jump in again, because you did it so nicely last time.
I suppose in terms of what are those kind of initial baseline messages, we all know that if you think someone is currently being harmed and unsafe, then you call the police. You know, if someone's currently at risk of harm or you have really grave concerns, then I'd really encourage people to call the police and get that support. Knowing that in the vast number of cases when there is police intervention, that will be linked with service support. So sometimes that can feel like a really big call to make, but I think that we know when we have those concerns, when it's really dangerous, that we make that call. And I think, like we're saying here, is that we also want to be intervening earlier and to providing people with support earlier, so that we can change those behaviours and increase the well-being of everyone in that picture. And so we're looking out for some of those signs in terms of people having maybe their ability to connect with you being increasingly controlled, You aren't able to engage with them in the same way that you did previously. You know, a lot of this time, especially when we're talking about sexual violence, we aren't going to see that harm happening. So we're looking at different ways. Our friend, that person that we're concerned about, we might see the way that they control their life and their connections start to get smaller and smaller. And that might make us feel in a position to have a conversation around what's going on. And again, these situations are really complex and nuanced, and a lot of us don't have the skills on hand to immediately do the right thing, and we're worried about doing the right thing. So reaching out to an agency like one of ours in your local community, just to have a conversation, to unpack some of your concerns, to even, you know, we've role played with people. What is this? How do I broach this? How do I raise this in a way that lets them know that I'm a safe person to tell, that lets them know that I'm going to hold their confidentiality and their dignity close to my heart, that lets them know that this isn't about punishing people, it's about ensuring that everyone can live to their full safe potential. You know, it's really hard for us to do that in isolation, and I would really encourage people to not try and come up with all of those ideas alone. Reach out to other people in your community who you think might be having these courageous conversations as well. Reach out to your local experts, because those are just some of the most fantastic calls to get, because we can't get into every home, but we would love to increase the skill set of every New Zealand family so we can have those brave conversations. So that would be my first thing to say to people.
I'm just thinking too, you know, we've been talking to other kaupapa Māori services around the motu, and particularly in some of the very remote areas where there aren't any social services physically on the ground there, and there's really poor access to both phone lines or internet of anything of that sort. So what we've had some feedback from, and I think this is awesome, is that some of the marae have opened their doors and have somebody there all through the day, just present there, and so that people can come in and use the phone at the marae for whatever reason. So not just crisis. So nobody is suddenly identified because they've got a crisis. So the using of the phone, if you like, is normalised, and it's available, so that particularly if you know, Wāhine in a crisis situation and they need to get out, and it's not, it may just not be safe for them to run from their home, or not be, they may not be able to do that because of the remoteness, then they can use that as an option. So I just really just want to put that out there so that people can take that back to their communities. It may be something that other marae can do as well. Just think it's an awesome option. You know, people are thinking innovatively here.
I think just one last thing, Jan, is for us as services. One of the things that has benefited me personally, professionally, and our service is connecting with the other services, because, you know, we experience the effects of the pandemic just like our whānau and communities. So sharing with each other the effects on ourselves has a calming and rejuvenating effect, and we've found it really useful. And if we're in a healthy space at this time, our people can be in a healthy space.
I think one of the things I'd love to see us keep from this whole lockdown experience is that sense of care that we are so living and dwelling with in Aotearoa. You know, it has been a hallmark of our experience under lockdown, is that we have thought about the most vulnerable, and we've thought about the elderly and the unwell, and because it's why we've all locked ourselves away. And I would love to see us continue to strengthen those bonds across whānau and across communities, because actually that's what turns everything around. And we've had to be innovative, and you know, we're going to need to keep doing that. And it's a shame that it takes a pandemic for us to sometimes be pushed into this space, because we live with this all the time. So I really hope that that sense of araha that's carried us through really continues on.
Yeah, I agree. I agree with Russell. I mean, our community response, our civil defence with most of the community agencies, including the DHB, MSD, have all linked to the community. And so we found that responsiveness really helpful in terms of spreading the load. You know, the food going out, medication going out, the call for help around PPE gear, which I think was absolutely terrible. Response for us on the ground to get protective gear was really difficult. But overall, the response from the community through civil defence was just fantastic. That response. I think the other one was Kyla mentioned it, is there you know, there are multiple ways to get that we already know how to get hold of people, and we've been, COVID-19 has been really good getting those messages out, how you can contact someone immediately. I mean, we haven't used crisis for a long time. We're an immediate response service, and that's what we do. We respond to that situation right there and then as required. And so I think, yeah, like the 1980s pandemic, our whānau have been resilient and have demonstrated that we've coped and managed really well, that our access to our supermarket was our sea, our bush, our gardens, and that most of all that kept us was aroha for each other. You know, whānau kotahi is still strong, to see families coming together, having fun, laughing and enjoying each other's company has been really great for our communities in Aotearoa.
Kia ora. With that, I mean, I've heard in that some clear hopes for what we might carry forward in terms of our future out as we move through this pandemic. I'm just wondering if anybody else wanted to add a quick idea before we go to the questions for what you want to see change permanently from this situation.
I think for Māori, Jan, the way forward is back. Meaning connecting to mātauranga, those old knowledges passed down to guide us forward. One example is practicing, as Caroline has mentioned, practicing the art of aroha, which includes compassion and care for each other. I think it's really important, not just for our community, but for us as services, so that we share in this together.
I guess my final word on it would be that we need to be the society that we want to live in. And we need to decide as a nation that we no longer want violence to be a hallmark of who we are, you know, and we need to do that individually and we need to do that collectively. And that's when we're going to start seeing a change, and there's lots of things we can be doing as individuals.
I think that what COVID-19 has really made us think about is that immediately we were all thinking about access issues and barriers for everyone. And something that I think we always hold in our hearts when we do this work is we've almost normalised or become complacent with the idea that only, you know, 20% or so of the harm out there gets either reported to police or comes to meet us for that healing and recovery. And I always hold in my heart the 80% of people out there, or the vast majority of survivors out there, with strong resiliency and other support, creating their own pathways towards recovery. And so when Joy talks about those really innovative marae and different community groups, the Māori Wardens, other people who have just been on that front line outside of our sector, I think about ways we can share our expert knowledge with all of those other groups, because we know that we just can't reach everyone. And so I think, you know, it's made us think a lot about that connection with local community groups, getting those messages out there, and being really creative and open to all of the different pathways to healing that will suit all of our different groups of people. And I think that that's one of the challenges, or not challenges, one of the opportunities for our sector and our government partners moving forward to share that expertise, to get as many families on board to create that vision that Joy was just talking about, you know, living in the New Zealand that we want to live in.
Nice. Thank you all. I've just got a couple of questions here. Though it does feel like we should just sit with the profundity of your reflections just for a moment, because I think, you know, they were offerings that I really do genuinely feel the hope of. So, okay, moving on to the questions. So as the first one is, as we continue to live in our bubble for a foreseeable future, does that mean that we're looking at different models of service delivery to address sexual violence and domestic violence?
Yeah, the contact is obviously going to change the effect, but also the way we contact can change the dynamics of what's occurring too. So how we communicate that, whether it's via digitally, whether it's by phone and that, how we convey that message is really critical at this time. So yeah, but obviously there are going to be restrictions around doing it face to face and things like that. But ideally, I guess we will be heading in the direction where at some stage, it's not something you can have over the front of a fence, keeping 3 metres apart out in the middle of the street for some of our whānau. But certainly we are finding ways of being creative around with what we have currently got.
I come back to the rangatahi. I think Russell's completely right. You know, the mode of delivery is going to be different. But for some groups, it may be that even when we're able to meet again, we might get a better reach with some groups of people by remaining in the kind of audio-visual field, if you like. So yeah, so that's interesting. I think there'll be some really interesting findings out of all of this. That's one that's been brought to our attention through some of our kaupapa Māori services.
I noticed a few, and this links to the second question. A few of you mentioned that some people you're calling instead of engaging digitally. So are there survivors that your organisations have been supporting with who are uncomfortable in that digital space, either from past experience or just they don't have the technology? And do we know how many people don't have access to the internet?
Well, you know, most of the hokianga is just written off, you know, and some of the far north, even over on the East Coast bays around there, they're just written off. You can't, the phone line, and I say a phone line, not a mobile phone, is one of the only ways you can get in there. But I come back to, you know, there's a way you can convey your voice and how you tell the message that can change a dynamic really quickly. But it's how do we as practitioners convey that message in a way while the crisis around them is happening. You had a mother in a car park with 5 of her children trying to do the shopping on just 2 hours out from the lockdown, and just the phone call of me calling her in that moment while she was ready to hit someone in the supermarket or stand in line for an hour, just letting her know that we're thinking about her in that moment. So trying to understand understanding our whānau well about where they might be at that particular moment and making that call and conveying that you're there with them, and yeah, just to bring some calm back to that.
It may be too, if the restrictions continue for some time and we're not able to meet in the ways that we might normally, that may need to become more part of a funding response, so that we're able to actually provide like data and some equipment for our whānau that are able to actually get reception. So yeah, so thinking about those in the longer term, rather than like there is some short-term response, but in the longer term that may well need to be factored in, I think.
Conor, were you going to say something, or was that?
Well, I think what Joy said was really on point. You know, the government has given us MSD has given us some funding, one-off grant to help survivors, and sometimes it's going to look like things we wouldn't normally be able to do, like help set up Wi-Fi, or do the grocery shopping, or help with accommodation. And you know, like, it's great to have those resources. We're not usually able to do that sort of thing, and it's, you know, I think, as Caroline said, that will be gone. That will go fast, because the need is so much there. And you know, so often this comes down to people's resources. You know, so really pleased to have that additional funding. The other thing I was going to say is, for some people, digital is great. For other people, it's just not. And, you know, I'm really conscious of the people that have dropped off because they don't want to do Zoom, or they can't, and it doesn't work for them. So we're going to have to keep thinking because we're in this for a while, I think, and we're going to have to keep thinking about who are those people that we're not reaching. I really love what Kyla had to say about that. What about the 80%? But, you know, and so that's a real, you know, something we'll all be thinking about.
Thanks. Well, that's all we've got time for this evening, but I just want to thank everyone who tuned in for this really important conversation. I hope everyone found it insightful, and I really, again, just massive thanks to the panelists who joined me today for your contribution to the conversation, but more importantly, the work that you're doing in our community, and the points for us to hang on to, for all of us to hang on to, in terms of holding a new way of working, of connectedness, of community, of love, of non-violence, that we can choose together to create for a future that will last for all of us. So I just want to thank everyone again, and now close off with a karakia, and then let people drop off as they'd like. So, whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina kina ki uta, kia mā taratara ki tai, e hiaki ana te atakura, he tio, he huka, he hauhu, ti hei mauri ora. Kia ora, everyone.